Good afternoon, and this is the Finance and Planning Committee meetings for the Health Commission. And Mr. Morowitz, would you do the roll?
Yes, I'll start with you, Commissioner Chung.
Present.
And Commissioner Guillermo.
Present.
Thank you. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to the item 2, which is the approval of the October 1st, 2024 minutes, meeting minutes.
I'll move approval.
And I second.
Is there any public comment in the room on this item? And there is no one has received permission to provide remote public comment today. So all those in favor?
Aye.
Great, thank you. The item is approved, and we can move on to item 3, the monthly contracts report.
Good afternoon, Commissioners. Michelle Ruggles, Director of the DPH Business Office. And I will run through the contracts. I have one representative here and more, I believe, online for additional questions. So today there's 5 contracts on the monthly contracts report. Just in summary, all of them met and had no findings for their citywide fiscal and compliance monitoring, except for Community Forward. SF did have one finding that they didn't have 30 days of operating or cash reserves, which is one of the items that gets evaluated. So that's just on the watch list, and they'll look to see how they're doing next time. But anyway, to go on to the first contract is a contract that is from our DPH section, Whole Person Integrated Care. It's Community Forward, San Francisco, SF. And this contract is for it's a new original agreement for continuing services for the Medical Respite and Sobering Center contract. This is authorized under our new ordinance authorization, which we in shorthand call the BED Ordinance 21A.4, which is why it's a new contract, because when we change the contracting authority, we have to create a new contract. So this is requested action is retroactive approval of this original agreement. It's a 3-year contract for the total of $19,422,000. We will be taking this to the Board of Supervisors. One of the reasons for the delay is we were trying to make sure that when we came to you, we had the details of some programmatic changes that have occurred since the last time you approved this contract, which I think was in 2020, December 2020. So I have a representative here if you'd like to know more programmatically, but in short, what has happened is that the managed alcohol program has now co-located with the Medical Respite and Sobering Center program, which was the result of further development of the program model and for the synchronicity and sustainability of co-locating the 2 programs. But in terms of specifics and probably a more nuanced description of what changed, we have, oops, that's me on this, sorry. Dr. Sharon, who's here, the medical director of the program, if you have other questions to ask.
Any questions, commissioners?
I don't, excuse me, don't have a programmatic question. I think it's explained pretty well, but I did have a question about the cash reserves issue. And this also, I guess, would go for the Felton Institute one, so you can address it at that point. But how do we look at the organizations that are highly dependent on SFDPH funds or government funds especially lately, as just the need for having reserves.
Right.
And being a standard is something that only gets looked at on an annual basis. So it's just something that, because I know if you're a federal grantee, there's a percentage that puts you over the top if you have more than one funder. I mean, a majority of your funds from one funder. So how are we monitoring, or how do we score that?
I don't have Wesley probably online, but what they look at is the citywide fiscal and compliance monitoring team goes out and has findings, and then they look at things over time. But what happens is a preliminary letter gets issued, and then the agency responds, and then they issue their final document or final letter. So in the case of Community Forward SF, what they talked about is when our lack of payment created them having a fiscal reserve, whether, I just read that, whether or not that is exactly the case. But they, that was part of it, but they also talked about how they are making a big effort to do more fundraising so that they're not so reliant on city general fund dollars for their programming. So that's a flag, right? It's something that they'll keep monitoring, but throughout the year, if other things come up, it just adds to the picture, and teams will coalesce around trying to figure out like how to resolve or provide TA or whatever the need is for a program. And so it will get monitored again, like you noted. But if that is the one factor, then if other things pop up, then that will just contribute to the big picture of what additional technical assistance needs to be provided. And so, go ahead.
Well, what do we do so if an agency has less than 30 days cash and they're at the beginning of the fiscal year or the beginning of the program, if they run out of cash in that year, how do we help them? Because we can't give them more cash. And if we're their primary funder, how can we assure that they're going to be able to maintain their service load or, their programmatic integrity? And it's not about coming, it's about what can we do more to sort of flag that in advance and help so that they aren't running out of cash, because you could lose people, they won't come back, your services degrade somehow. I mean, it's just something that, particularly for the big agencies, actually for the smaller agencies, because they don't have a lot to, maneuverability within their, their financials. But
I can ask, I'll have the fiscal and compliance representative come and speak to that, maybe just as a general or specific questions. I can only say that they keep an eye on, and as agencies pop up with problems, there's a whole, I think I talked about it here, like a fiscal, there's tracking and discussion around entities, especially like the controller's office might flag, they've changed the name, but you might have heard red flag status, like to tier 3. So there's a lot of involvement to try to stabilize contractors, and it really depends on what's happening to what the remedy or the solution or the help is going to be for that agency. I will say on the Felton contract, they, and maybe I didn't provide all the documents, but again, they issue a preliminary letter, they respond, and so the final letter has them in conformance.
yeah, I mean, I did see that, but it just, it was a flag to me that that 2 of the contracts that we're reviewing were having that issue. And so it just begs the question, how do we help them? How do we handle, the need that is probably an ongoing one? So if an organization is going to be now relying more on fundraising, that is so variable in any given year. Yeah.
I think that the key here is really, well, we're not here to do their job for them, of course, like, so they the one who's supposed to be like running the program, making sure that it's in operations. But I think the sustainability part, maybe that's something we can ask them in advance, at least get them to think about that, like, so, because if it's a project that starts with a proposition, chances are it has a shelf life. And what are we going to do when that proposition sunset? Do we close the program immediately, or or if there's like enough evidence to see that it's worth keep it open, and what are we going to do about it? I think that part we have a role in, but I think in terms of the sustainability of the organization itself, they should have a plan in place.
Yeah, I think especially given the tightness of our budget going forward, we don't have a lot of flexibility in being able to, provide alternative solutions, at least from our budget. And so this issue of sustainability beyond a dependence on SFDPH or city funds. So I know Felton, for instance, has money from all the departments in the city. And I know that now the departments sort of coordinate, the review and problem solving. And so it's just, again, something that can become worrisome. Actually, it doesn't matter what size organization, it's just that for the good of the recipients of the services, beneficiaries of the services, as well as the sustainability for the organization itself, their staff, and so on.
Yeah, and I want to just channel like Commissioner Chow, and he always, asks the same questions. If they're so heavily dependent on the city for funding, why can't the city actually just do the job, hire our own people to do the job, than to just like fund somebody else to do it and like risk having it closed? So I think that it's a valid question, especially like how things are transpiring these days. Yeah, so it's about like what's realistic, and what's not. I'm not quite sure we were able to really address that as a whole system.
Well, to go like back up, we have to get permission to contract out services at all. So we go to the Civil Service Commission and present, like, we want to contract out outpatient or residential or a drop-in center. And we go at that point and explain, and there's a process that involves if the union wants to discuss it or object, but it's required that we go and speak to them and present. It's called a personal services contract, when you would have someone else doing services that may or may not be able to be done by the city. So there's a lot of reasons that that we have and present, and so I think it's on an individualized basis, but sometimes, for one, we don't have all the locations. We don't have the rapport in all cases at the community level that's been established. We're the government. Some people who are marginalized that's not who they want to come get their services from, and so we work to support and build that trust. But so there's a lot of reasons why we have services contracted out and not provided by the city. And I don't think we would have we wouldn't have the breadth of services if we didn't contract it out. But I think anytime a vendor goes into a deep hole, or there's always a transition plan, and sometimes that is bringing the client in-house or transferring them to a clinician. So I think it's always very intentional. If a vendor's closing, it doesn't just close without a plan of what happens to the client. So that's the first and foremost responsibility that the department takes, to make sure that the people that are being served are the least impacted or can be mitigated as much as possible. So, but lots to discuss on that topic.
Yes, well, thank you. I think that, we have similar discussion quite a few times, like with different programs and projects, including a health center, which continues to be open today, knock on wood, and hope that they will continue because their name is a legacy name. So I think that it's important, like to find ways to make ourselves more aware of that. It's like I said, it's not our responsibility to tell them how they run their business. But it is kind of our responsibility if the money come from us. So that's the tricky part, I think.
Yeah, in any case, and then this program just seems to be doing so well otherwise, and so you wouldn't want it to all of a sudden suffer, the difficulties with their financials that wouldn't allow them to continue really important and needed services in the city, and it probably is only going to grow. The need is only going to grow. Yeah,
Yeah.
at least in the short term. Yeah.
Okay, is it okay to move on, commissioners? Okay.
We just want to have a chat, that's all.
Oh, sure. No, and I've noted all this in the minutes. It's very important, And also, just a quick added thing to what Ms. Ruggles said: if the city takes on something and they hire staff, that's permanent staff, that the city can't let go of unless there's, it's actually a big deal, and then those people are locked in for retirement. So I know it's a bit of an arduous process on that side as well. But anyway, let's move on to the next contract.
Okay, the next contract is Curry Senior Center for Socially Isolated Older Adults. This is, again, an original agreement for continuing services that you last approved it in April 2022. Let's see. So this went out to bid, and they were reselected. And so it's new contract authority to the new bid, and so that's why this is a new contract. This program, or this request, is for 5 years. The 2 years last year and the proposed, or this year, are compared, so you can see the change, and it's flat funding. This program is focused on socially isolated older adults with mental health concerns that primarily live in the central San Francisco neighborhoods. And I'll leave it at that. If you have any questions, it hasn't changed from the last time, really, that you've seen it.
Just a question on the unduplicated clients on the report, which was, I think, I was trying to understand, part of it was staffing issues and part of it was just the way that the data was recorded, or is it primarily that programmatic issue of lack of staffing? And has that been resolved?
Oh, are you looking at the monitoring report?
Yeah, I'm looking at
sorry.
the monitoring report.
I didn't bring that.
It's the unduplicated clients that were contracted for 320 and the actual was 63.
Okay, do you do you know who is online for this contract?
I don't have the list.
Oh, sorry, right.
Let me look it up.
I ran out here thinking it was started at 2 and forgot the list of the presenters. Is there somebody online that is here to represent Curry Senior Center?
This is Teresa Yu. Are you able to hear me?
Oh, hi, yes. Could you please speak up?
Oh, yes. Hi, this is Teresa Yu.
Oh,
The program
you were very,
manager.
very faint. Can you get closer to the microphone, please?
Oh, yes. Hi.
Much better, much better.
Teresa Yu, Behavioral Health Services Act Program Manager, and I'm the Program Manager for Curry. And for the there's a monitoring report that you're looking at. I believe there have been some staff shortages, perhaps due to COVID, but they are fully staffed now. And this fiscal year, they are targeted to outreach to 240 adults.
Okay, that's still less than the contracted, so would we be asking them to revise the number, the contracted number, based on, still a lower projected actual per the contract?
The 240 adult target is actually in our system of care performance objectives, which the contract, the appendices would refer to as their new goal for this fiscal year.
Okay,
We
so
do
it's not,
allow them some, excuse me, sorry.
so it's not the 320 anymore? This contract
That's right.
that shows up on the monitoring report. There was also a point here, and I'm not sure if I understand it, but it says that all of the invoices showed 0 UDC provided, and it says that a BOCC advised a program to ensure that it provides the UDC during the year to the persons who submit the invoices to make sure it's an accurate count. So is it because they just didn't document on time, or the invoices didn't show the number of actuals on that?
Yeah, that's right. They had finance staff submitting the invoices, and it's been addressed with the agency to let them know that they need to collect the number and report it on the invoices, even though they are reporting it in other ways in our system of care reports. They were reminded, that we would also like to see them on a monthly basis through the invoices, so they have agreed to that.
Okay, so it was just an omission error.
That's right. Yeah.
Okay, thank you.
Thank you, Teresa. Is it okay to move on to the next contract, Commissioners?
Yeah, please do.
Okay. The next contract is for NAMI, who is using Felton Institute as their fiscal sponsor, which is why Felton Institute shows up first on this list. But the requested action is an amendment to extend the contract by 2 years from 12/31/24 through 12/31/26. The program services aren't changing. It's peer education and support programs to help individuals and families living with mental illness. We're bringing it here today because it's now over $500,000 annually. What else? I think that's it to say about this.
Oh, I was just wondering why the letter that was issued in July was from the Children, Youth, and Families and not from SFDPH?
Because it's a team, and it's a team. The citywide fiscal and compliance monitoring is organized through the controller's office, and it rotates who's the lead.
Oh,
And so that's why.
So then just the same issues that were articulated with the previous one around the cash reserves, but it looks like it was resolved.
Right.
And so just ongoing monitors. This is one of the big agencies, I think, that we want to make sure is able to cover that full ranges. I mean, they're a fiscal agent, right, for a lot of programs?
No, not
Oh,
really.
They run,
They run
oh, okay.
they directly run their services.
Okay. Okay.
This one's unique.
No other questions from,
Okay.
Moving on.
The next one.
Okay, sorry. The next contract is Harm Reduction Therapy Center. This is a new original agreement to continue existing services, same as the other situation, that it was rebid and they were selected with a new contract starting July 1st. So what we're requesting is a 5-year contract with an annual budget of approximately $899,000. The services haven't changed, but I did look at the actual solicitation language, just to get a better understanding of that. So I think, what's in there isn't incorrect, but so it's clinicians who are going to staff the city's mobile behavioral health team, so they'll provide that clinical person. And it's a team of behavioral health clinicians that provide services throughout the city. They'll set up at a specific location identified as hotspots of assigned neighborhoods, and the hours of operation, at least from the RFP, I think it's the same of Monday through Friday, 8 to 5. But I think we have a representative online if you have more questions about the programming.
Any questions, commissioners? Or
No questions on my part.
Okay.
can we move on? Thanks.
Great. The last contract is UCSF ESF program. You actually approved this just last February, 2024. What we're asking for today is an amendment that would increase the funding by adding $250,000. I think I don't have it right here. $256,000 in 24-25 and 25-26. So it's a reallocation of sugary drink distribution funds that were allocated to this program to enhance, I think it's the provision of vouchers. So that's the only change. There's no change to the term.
Is it because those funds we weren't aware that those funds were going to be allocated until just recently?
I don't know how they came about, like why they were unspent. You know, actually, I think, is Aileen Armstrong, MCH online?
Let's see her. No.
There was a lot of movement during the budget process with the mayor's office and how much funding there was going to be in this line item, or in this fund. So it could be that. I'm happy to find out. I'm not sure.
I mean, I'm just curious, and then I was wondering if that was the case, if there were any other similar funds that you anticipate might be made available to other programs.
I don't have a list of that offhand. Technically, if your funding is general fund and it's unspent, it's supposed to revert back to the city general fund. Sometimes we're able to carry it forward, which kind of happened more during COVID. If it's a special fund, like the sugary drink tax, it doesn't go back to support the general fund. And so, like the larger general fund, which is why I imagine it became available. Once it became available, they were able to add it. And my assumption is that they're adding it here because it's easier to expand this type of programming on a one-time basis without like hiring ongoing staff, et cetera.
Right. Okay, thanks.
All right, commissioners, I believe that's the last contract, right, on this? Am I correct, Ms. Ruggles? Ms. Ruggles, that was the last one?
Yep.
So commissioners, please consider a motion to recommend to the full commission to approve this on the consent calendar today.
So I'll move recommendation or approval recommendation.
Recommendation that the full commission approve this at the full commission meeting today.
Thank you.
You could just say that. You could say what I said. I mean, or just say that and second it. Yes. All right. And all those in favor?
Aye.
All right. Thank you. We can move on. Thanks, Ms. Ruggles. We can move on to item 4, request for approval of a new professional services agreement with Civic Edge Consulting. Is Dwayne Poe here? Dwayne Poe. And Dwayne Poe is not online either.
Okay. Well,
Um,
so what you have here is a new contract with Civic Edge Consulting. I'm just going to read it, but to request for approval of a new contract to perform stakeholder outreach services. The total proposed agreement amount is $200,000, which does not include a 12% contingency as they're using one-time funding, and this is just for 1 year from November 1st through October 31st of next year. This, they selected this vendor through a solicitation, an RFQ, a mini RFP off of an already established RFQ to obtain these services. And the services that they're going to provide are described on the second page, which is an analysis of emergency preparedness communication. So they'll be helping to do project management, engagement planning, implementation of engagement, and then monthly reporting. And this will be a contract that is for the Population Health and Emergency Preparedness and Response, FEPR section.
Any questions, commissioners?
Do you recall what other because we've worked with them before, right?
Yeah, we have.
And I'm just trying to remember what other,
I don't remember
Yeah.
that, but we did.
but the company sounds familiar, so
Right,
I'm
yeah.
assuming that we're,
I think they were here a meeting or two ago, same thing, and I don't remember what the function was, so I can look back if you want me to.
no, that's okay.
This is Mike McGurk. I'm from Civic Edge Consulting. I'd be glad to answer that question.
Oh, okay, great, thanks.
Yes, we've worked on the opioid use disorder campaign that's still running. That project we've been working with Deirdre, and I believe a few years ago we worked on the soda tax campaign. So we've had a few projects with SFDPH.
Thank you, that's the one that I remember is the soda tax one, yeah, okay.
Great, thank you.
Thanks for jumping in, Mike.
No problem.
If no other questions, commissioners, please consider a motion to recommend to the full commission approval on the consent calendar today.
I'll move that.
And I'll second.
All right, all those in favor?
Aye.
Aye.
All right, wonderful. Thank you, Ms. Ruggles, for jumping in. Let's check with Mr. Poe on that one. Item 5 is emerging issues, commissioners. I heard
Yeah.
I mean, what?
Just the one about the, how we're anticipating the sustainability issue, I think that Commissioner Chung raised, and then just, the general issue of our working with organizations that are having cash reserve or cash flow issues.
And would it be helpful to have a whole item on that and have several people come and just talk about how the DPH interacts with that, so that at least you're filled in?
I think that would be great as the initial conversations, because it's really slightly philosophical as well, to really look at our role and if we're doing enough, or are we doing too little, or are we doing too much?
Okay, yes, I will get that on the agenda for a future meeting. Thank you so much. And then is there any public comment? Oh, no public comment in the room. And so please consider a motion for adjournment.
Move to adjourn.
I second.
All those in favor?
Aye.
All right, thank you so much. Thanks for attending the meeting, everyone, and have a good day. Give me 30
Go
seconds
vote.
to close up.